Okay, so it looks like the treasurer's report is that we have a balance of $2,219.19. And we're looking at the recruitment of mental health board members. And we're going to be talking, Bob, about what the process is further down, but it looks like we have 3 vacancies, one in District 2, one in District 4, and one in District 5. Tori, does that resignation we have make 2 in Gore? I don't know if you put the agenda together.
I did put it together, and no, by my count, it's just 1 in District 4. But I'm more definitely double check if you want.
Yeah, and so we had 1 resignation in District 4
Yes.
for personal reasons. So
that's the vacancy is District 4.
yes. And that was our newest member, right?
Correct.
Yes. Okay, so we'll talk about the process in just a second. The minutes for July 13th, everybody should have gotten, and we will approve those at the meeting on September 21st. So that's the 4th thing on our agenda is the application process for potential members. So Bob, you're the one that brought that up. Do you want to talk about it?
Well, I can bring up some of the points. Maybe others can fill in, you, Kathy or Tori. I guess it is, and it seems to have been for some time, a bit of a jerky process without necessarily consistent structure to it. And I know when I joined, certainly I think Marianne had indicated, I learned from her that the normal process encourage at least an attendance at the executive committee at least once, and maybe 1 or 2 mental health board meetings prior to either submitting or getting approval or appointment to get a sense of what's going on, and also have the opportunity for the board to meet the applicant. And that is not seeming to happen or with irregular frequency anyway. And we also some time back have talked about potentially a mentoring process, which has never occurred. And we used to, when we still had the liaison, there was the opportunity. I know for myself, it was Mike Lucid had sat down and we had a meeting where he brought me kind of up to speed on the background of MHSA and so on for a couple hours. And that proved to be informative. I guess we're still giving out, and Tori could answer this or at least look for the documents if they haven't been being given out. There are some documents that are given to new appointees to kind of give them a grounding in the process, what's behind the mental health board, their activities and so on. So I would like to see a bit more uniformity and a bit more upfront as to the types of exposure that an applicant would have to the mental health board prior to joining, and more support in their early stages of being a member on the board. And if you have other things to contribute thoughts about that, I certainly welcome them.
So those are all good points. I think that it's things have happened, like you said, not consistently. And part of that is that ultimately the Board of Supervisors are the ones that appoint, and they can do it without our input. But our input is suggested. So I know that there was a question about the last appointee. And she personally knew the supervisor and they had been talking. And I don't have accurate records of the meetings she attended, but I believe she did attend at least one or two. I think I'm a little bit frustrated by Zoom actually realizing who is attending and being introduced to them. And if they're a prospective board member, maybe one thing that we could do is put them on as a panelist if they, because I think that if they're not, then they're invisible to us and we really don't know that they have been here. And maybe we need to really take some time and define the process better. The mentoring part is big because I don't think that our newest board members have been assigned a mentor. And I think that that would be a really good thing, especially since we don't have a liaison, like you said. So does anybody else have thoughts on how we can refine that? Whether, yes, Carol.
Yeah, I think one of the things that we've struggled with is having a Board of Supervisor representative to our mental health board meetings. I know that they do have meetings on Tuesdays, which makes it really difficult for them to attend our regular mental health board meetings, but perhaps this morning meeting, the executive, might be a better time for them to attend, because I think if we have a better conversation with them and include them in this process, they're more likely to, keep us in the loop with who they're considering for their candidate for the mental health board. And I'm sure if we come up with a job description and a process that we would like them to follow and distribute it to the mental health board member, the Board of Supervisors, at least their administrators would be able to help out with that, perhaps, if the Board of Supervisors themselves are not directly involved with that process.
And I will admit that it's possible that I saw applications that somehow didn't get passed on. It might be, and I can't remember the timeline. I know that I did see the latest application, but I think it may have been after she was appointed, but I did see it and I don't know that I passed it on, and I don't know if you guys saw it or not. Tori, your hand's up.
Yes, thank you. So I just wanted to put out there that I did send email information to all three of our our board members, the newest ones, which has the bylaws, things that Rhonda taught me to send out to the new members. So I did send those out, and I will move forward, when we do have new members showing up, try to connect them with a mentor in their district, trying to, because I agree with Bob, it was a little bumpy for these new people, and they were a little, kind of confused and whatnot, but I definitely will work with whomever is in that district that the new person is showing up in, that we can get then going on. Yeah. And then on a side note, sorry, Bill's double booked and he needs to present so he can get going.
Okay. Sounds good. So, Bob Cobb, can we come back to this?
Absolutely. Go ahead, Bill, as far as
Bill?
I'm concerned.
And I'm sorry, let me be clear. I'm not telling you I need to to present early. I'm asking for permission to present early so I can.
Mission granted.
Thank you. Thank you.
A mistake, Bill. Sorry about that.
No, that's okay. I just try to manage my people's perception of me and how I'm walking around the world. So, all right. So, so some of the big news is in the area of funding. So we get two grants annually that come from the federal government to the state to us. So the Substance Abuse and Prevention Treatment Grant, it's called SAPT, S-A-P-T, and the Mental Health Block Grant, the MHBG. And they come to us with directions on how to spend it. The money comes in little categories, and we submit a plan every year to about how we want to spend those monies, and the state approves it, and then we move on. Because of the additional funding the state received in the American Rescue Package Act, the ARPA, and another one whose acronym I can't remember, we're getting additional supplemental monies this year. So it came to us unexpectedly. We had to respond quickly. But there's about $2.5 million in additional funding available for under the SAPT grant to spend over, I think, 3 years. And then there's an additional 1.2 in the mental health block grant. So we have submitted our SAPT application, largely expanding some of the substance use services and trying to support some of the homeless outreach programs as well because of their interaction. And in the mental health block grant, we're preparing our application. Most of that money is earmarked for a very specific program, a first episode psychosis program called Care Coordination. And this is the program that Aldea, Buckaloo, and the Elizabeth Morgan Brown Foundation and the One Mind Institute are bringing to Sonoma County. And so that money, which is a significant amount of money, it's about $1 million, is going to be, our plan is to submit that money go to them. And then there's a small amount of money in crisis stabilization and early intervention. We're going to propose that we use that to support peer support positions in the CSU. So that's been a priority on our list. We have a extra help person and we want to turn that into a permanent position, and we want to add a position. So we'll see how far the money gets us. It's not as much money as I wish it was. I think it's about $150,000, but we'll see if we can use it to kickstart positions that we can fund ongoing. So that's some new money we're working on. The state released a RFP for crisis care mobile units, CCMU. It's largely an infrastructure grant available to counties to support the establishment or expansion of mobile crisis. There was $500,000 set aside for a county, and then after that, you can compete for up to $1 million per a unit or program you want to establish. The county is not in a position to expand its MST program with infrastructure monies. I can't remember if I said the money is largely for infrastructure, so it's one-time expenses. It's not ongoing. 25% for services, 75% for infrastructure. So because of that limitation, because it's not ongoing and it's not infrastructure, the county really didn't have any expansion efforts it could support. However, Santa Rosa, Petaluma, Roanoke Park, and Cotati are all bringing up their own mobile support teams. we're partnering with, we hope to partner with Santa Rosa to run their team with our staff and their staff. So we worked with them to include them in the application. And then we proposed that the county lead an outcome and evaluation collaborative of all of the 4 teams. So there will, if they get funding, we'll have the county MST team, the Santa Rosa in response team, and then Petaluma has the SAFE team, and then Rohnert Park and Cotati will have new teams that'll be just like the Petaluma model, same provider, same model. So there will be 4 programs up and operating, and what we want to do is we put in for some money to bring us all together to work on an ongoing basis on outcome and evaluation of all of the mobile support programs. So the idea is to share the same data dictionary, the same data collection processes and platform, and the same reporting processes, so that we're able to capture lessons learned and use that for program improvement, evaluate the effectiveness of the programs in different areas so that we can have some comparison. So that grant was submitted early this week, or last week, in just under $3 million in submissions for that grant. So that grant's been submitted. And then yesterday in the board meeting, the ad hoc committee and staff submitted its initial Measure O recommendations to the board. The board reviewed them yesterday and made some decisions to accept some recommendations and to continue to look at some other areas. And I don't know, do you want me to review specifically their response to each recommendation?
Can you give an overall?
So the things they accepted is the psychiatric health facility. So they're going to use the Measure O money that's available for that. But the controversy is there's not enough money to fully fund the PUF. So the decision that they had to consider is, if we don't have all the money, are we committing to backfill it somehow? And so they decided they would spend the 1.6 and look for another 1.5. And what they may do is use some of the money in the transitional housing budget to put up part of the money to address part of the shortfall, and as kind of a good faith effort to the hospitals who they've asked to help as well. So the idea is if we split this 4 ways between the 3 hospital systems in the county, would you guys pitch in to get the PUF up and running? So they made that decision. Did not commit to the transitional housing. Yeah, Carol.
Yeah, I just, with that transfer of funds for, I'm assuming, a short period of time, because I was at the meeting yesterday as well. My understanding was that there was other funding coming down the pike from the state that would be able to fill in that shortfall in transitional housing funding. If you take it from transitional housing, you can't spend it from transitional housing. Yeah, exactly. So am I correct in understanding that there is an alternative funding source or not?
Close. So what we proposed on transitional housing is this. The state is going to release some grants later this year for behavioral health infrastructures, and that money will be used for capital purchases and improvements. So it's designed to buy buildings and property and build properties for behavioral health facilities. So because the transitional housing money is relatively limited, what we proposed is it would be a better strategy to hold that money and wait for a grant to see how many properties we can get funded through that grant process, and we should be fairly confident we'll get some property through that process. It's a very large bucket of money, and I think we'll be very competitive. So use the state money to buy the property, and then use a portion of the transitional housing money to operate the program year to year. And so what they're saying is, well, because that's going to take a while for you to get the grant and the property. That money's going to be building up in the bank. So what we wanted, one thing they proposed but did not decide, Supervisor Corsi proposed, what about we take that money that's banked and use it one time to make this pitch to the hospitals to share the backfill. And in the transitional housing area, we made three recommendations for the money. One was what I just described, which is let's bring in more transitional housing to deal with the bottleneck we have in that part of our system. The other one is to create a county housing manager position within behavioral health, because the issue for us is we're not doing a good job monitoring the subsidized housing we have for our clients, because everybody's just over-assigned. So we need somebody whose job it is to keep track of the apartments we already have funded over the years through MHSA, new properties that we fund through Measure O, and then there's roughly 70-something units coming online over the next 1 to 3 years through No Place Like Home projects that have been funded. And so we want a position to manage those properties for us and make sure we're getting our people into them, and we're putting the services in place to support them. And then lastly, we have been partnering with the probation department on a grant-supported project called the Justice Mental Health something program, JMHCP is the acronym. And it's they have the housing, but they need money for the ongoing case management. And so we are proposing that we continue to support that pilot project that will close if it doesn't have sustained funding, because they're running out of their grant money. Yeah.
And so, I'm just wondering, I noticed that there were a lot of opportunities for case management, and I'm wondering if there has been thought given to expanding case management capacity by using a licensed professional with a team of peer support specialists to help with that.
The case management in Measure O is in the behavioral health services for homeless population. What they decided yesterday was to use one portion of that to continue funding for the HEART program, which had time-limited funds that was given to it by the board, and then to collaborate with the cities in their outreach efforts to just make decisions about what to do with the other money. So that's as far as the decision-making has gone on the case management monies in the Measure O pots.
Yeah, do you have influence to add community health workers and peer support specialists into the discussion? Because there's a grant application went in through the Public Health Department for community health workers, and the SB 803 peer certification would down the pike allow for Medicaid billing for peer support specialists. So both of those would potentially have their own funding source, and could expand the reach of, if there was one licensed social worker or, public health nurse, or she or he could supervise a whole team of folks that really have the, knowledge and capacity to connect with people, from the community, who have that cultural competency, language skills, have the code shifting capacity. And it's not always language, it's often street smarts or kind of resource and referral knowledge base that they have from their own personal experience. And it often gives a better follow through than maybe one person could potentially do. Because I just know from the discharge planner at the jail, that was the one thing that when we interviewed with her, she said if she had 10 people like herself, it still wouldn't be enough. And it would really be very helpful to have, people like the folks that have been employed through the whole person care, which is coming to an end at the end of the year. And my understanding is that the enhanced care management and in lieu of services through CalAIM are also kind of filtering through the system. I'm not sure exactly how that's going to kick in or how that will impact Sonoma County, but I do know that those are two areas where both community health workers and peer support specialists will be able to be added in, both for fee for service and in managed care, kind of team-based care capacity.
Yeah, so I am a supporter of the strategy you outlined. I'm probably a person who frustrates you because I don't have more specific plans moving in that direction. One of the reasons is so I see this as a great opportunity, and I'm looking for steps to take. So one of the things I think we talked about, lots track of what we haven't talked about, but in the ARPA funding that the county is going to distribute, we worked with West County to develop an internship placement program. So that's one way of using a developing opportunity to create the pipeline for individuals to get work experience and for us to get experience with folks placed in our programs. And to prepare for when Medi-Cal is available, peer support services are becoming an available service through Medi-Cal. The issue about Medi-Cal billing for peer support comes with obstacles. So one obstacle is it requires a match. So you can't provide a Medi-Cal service without having some of your own money to pony up, and it's roughly 50-50. So for every dollar we spend on a service, we have to pay $1. And then you have to look at what costs are associated with billable services. So, you know, there's an issue with our staff that they do a lot of things that aren't billable. So it's like 100% of their costs aren't covered by half of FFP. So that's a thing that's always an issue to fix when you pursue these strategies. The other is that the state's momentum is not towards peer support specialists, in that they have network adequacy requirements where they say to us, you have to have so many licensed people in your system, and if you don't, we'll fine you. And at this point, they have I have heard of no intention for them to add peer support to that network adequacy. So every time we have to make sure we're covering our network adequacy with the requirements, doctors and licensed people. And then once we're covered, then we can look at what money we have left over to do other things. And so those are two hurdles to keep in mind as we look at the peer support option.
The network adequacy requirements are coming from CMS?
Well, it's the state's interpretation of CMS. So CMS negotiates with the state, so it's DHCS. So when you hear people talk about the NACT, NACT, that's the Network Adequacy Compliance Tool. And so this is a very controversial issue because the counties feel that the state has taken a very unfair approach to this, and it's inefficient and unfair. And so we are arguing with them regularly about it, and they are very, very serious about this. So we have to submit. Anyway, that's another topic. But
yeah,
my point is, I don't have specific ideas, but it's always on my mind, and I'm looking for ways to use opportunities to create peer support in our contracted services and in our county services.
Okay. Maybe I can kind of connect with you at another time. I'm busy. There's a letter, a stakeholder letter required by September 3rd, which is Friday, for the community health worker Medicaid waiver, which is apparently they are hoping, the timeline is that it will be submitted in December with a start date January. If that goes through, that will truly change the way that community health workers are perceived. We've really struggled with sustainable funding. That's separate from the peer support money. And the other money that we've applied for, and I believe my understanding is that we have a good chance of getting, is the community health worker money through the CARES Act. And community health workers go by many names, and many of them, certainly from Bureau of Labor and Statistics, the peer support specialists are included under community health workers. So just to kind of keep that as an option, I know it doesn't get around the billing issue, but there's a lot of moving parts, and there is a flood of money coming in for community health workers specifically through CARES Act.
We need to keep all of these. We need to like keep an inventory of all these opportunities and look for ways to put them together to create changes.
Okay. All right. Yeah, thank you for the time.
Sure. All right, MST. So there's a chunk of money for CAPE, which is the school crisis program that was closed down a couple years ago, and MST expansion. And in general, their decision was, let's hold off on making any decisions on this to wait and see what happens with other money. So the state is issued the CCMU RFP that I talked about. They're looking at doing a Medi-Cal billing move that would increase the drawdown, the percentage of federal money you can draw down for mobile support. There's potentially other money coming down, and then the 3 city programs are also doing things there. And so the decision was, before we make commit any of the MST funds, let's look at what's happening with all this other business and see what shapes up so that we use the money in the best way. Santa Rosa Junior College has a counseling project that increases outreach to and services to diverse populations on their campus, and that project got the go-ahead to move forward. SUD expansion, we proposed creating 3 administrative positions designed to bolster the SUD program, which is severely understaffed and really can't take care of its current programs, couldn't manage Measure O expansion, and couldn't prepare for the ODS waiver we hope to apply for in a year without those 3 positions. So they okayed that. And then the remainder of the money will be released in an RFP for youth SUD services. So those are, and then we will be working towards, over the next year, preparing to make the case to the board in the state to join the ODS waiver, which would, expand our SUD programs quite a bit. So that was okayed to move forward. As I mentioned, HEART was funded for a year, and then the other behavioral health homeless funds are being held until we work with the city. The county wants to work with the cities to talk about integrating the different projects, because they have their own homeless outreach teams as well, and they want to look at what's happening and make sure we have a comprehensive plan. And then there's a small amount of money for capital purchases, and the county CDC is in conversation with the cities about a number of projects that range from more hotel purchases to creation of safe parking areas to perhaps other shelter or village, tiny home projects. So they're saying they want to hold that money, continue to talk with the cities, and look for the best opportunity to use this money to leverage these other projects, support these other projects. So we will come back to them with recommendations on how to use the uncommitted funds, over the next month or 2. They'll probably review it again in a December board meeting.
Okay, any other questions? Bob Hale.
Bill, now that your funding is relatively stable, how's recruitment going for unfilled positions?
Not well. So I'm assuming this is COVID related. We recently had a long open recruitment for 10 behavioral health clinician positions, and I think we filled 2 through that process. So we've had to start over another recruitment process. We're struggling particularly in the area of nurses. There's a nursing shortage. There's a shortage of nurses who want to work in our CSU, which is our primary need. Unfortunately, we've had a number of nurses either injured or, unable to come to work. And so we've had a lot of shortages there. So we're struggling there. The registries are also having difficulty providing people. So we use registries for substitute nurses, and they're having trouble as well.
Were you able to recruit a manager for the CSU? New manager?
Yes, Angel Cassidy is here,
Right.
and she is doing a great job. We are also creating a new program manager position in the CSU. So up to now, Angel is what's called a client care manager. So it's a relatively high level clinical supervisor position in our system. But she's the only manager for the CSU, which operates 24/7. So that's not a good setup for obvious reasons. So we are in the process of adding a program manager to the CSU so that we can have a manager on the floor during another set of shifts that Angel's not available. So there will be a behavioral health clinical specialist, a program manager, and a client care manager that will work as like the management team for the CSU. So we're building that up.
That's great.
And if I'm not mistaken, I heard you earlier saying that you were going to allocate, if you can, the 150,000 towards a peer support
Yeah.
specialist in that position, in that location.
We have a client support specialist position that was held by a peer. It's extra help, and when you're extra help, you're only allowed under labor regulations to work so many hours a year. And so she used up her hours and had to take another position with the county. So we lost her, which is a big loss. She's an important person there. So we are proposing, we're looking at a strategy to turn that extra help position into a full-time permanent position and seeing if we can fund that. And then we have another allocation that we want to fund as well. This would be a new allocation. So our goal will be this year to have 2 peer support positions working full-time in the CSU. So I hope to use the mental health block grant money to help kickstart that process. That's all contingent on the state accepting our proposal. So we submit that to them next week or week after next. So they need to accept that proposal, and then the county's got to, I've got to come up with the money in our budget or talk to the department about additional money to make that possible as well. So that's an example of where adding peer support specialists is on our mind, and we're looking for opportunities to do it. So the mental health block grant money presented itself, surprised us, we couldn't plan for it, and we're making that a priority for the plan development with that.
Thank you.
Okay, any other questions or comments for Bill?
So some of you know, but Melissa Struzzo has been promoted to the SUD section manager position. So she replaces Diane Madrigal. And now we begin to recruit to replace her as the program manager.
Okay, so I do have one comment, since I know you have to leave, Bill, and you won't be here later for my report, but it's related to the homeless situation. And I'm sure that you heard, I wasn't able to be at the Board of Supervisors meeting, but I know that there were people planning on talking about the situation that we're having out here in Guerneville with fires. And I personally, I live in one side of the canyon, and I called in the fire that was, heading up the hill through heavy timber across the canyon. And so we've had multiple fires set out here by people who were cooking or warming or whatever, and setting fires in the woods right now is not good. So I'm really hoping that I know that West County is working hard on it, and the county is working on it also, getting people into a situation where they don't feel like they have to, um, you know, have fires to cook or keep warm, and trying to provide. And there's a lot happening with that. But I have, in watching people's comments, and I will admit that this is a Facebook thing that I've seen, but it is people's comments. And Laura's Law has come up because there have been people that have set fires and done other things, and people are fairly certain have a mental illness that's not being treated, and they've possibly even gone to jail and then been released. And there's legitimate, I think, fear about the fires being set out here. So I just wanted to make that comment and let you.
So, yeah, we discussed that at length at the board yesterday. So can't remember if it was Supervisor Corsi or Supervisor Hopkins, maybe both of them brought this up. And I restated, and I'm happy to talk about this in more detail, but my position on that is this. One, I would like us to have a Laura's Law program. So I think that there is reason to have that program. Two, I don't think we should have a Laura's Law program until all of our voluntary services are adequately funded, because I think Laura's Law should be a last resort for a small number of people who will benefit from this. And it's short-sighted to add an involuntary program when you don't have adequate voluntary programs. And then three, I just want to caution folks, Laura's Law doesn't do as much as people think it does. So the short version of that is there's a group of individuals who don't want to participate in treatment and get into trouble with the law a lot. And what this does is this says now you have to go to court and see a judge, and a judge is going to tell you to engage in treatment. There's no enforcement. Nobody can, that's as much as happens, really. I mean, there's more details we could talk about. It's described as the black robe effect, that it just gets someone's attention and they believe they have to behave because a judge tells them to. So that's a small number of people that will respond to that. And it doesn't offer anything more than that, right? So all you can do is grab somebody and bring them into court, and over and over, right? So I want to say I'm in favor of that when we are providing all the other services we can, because actually voluntary services are very effective. If you have them, we just don't have enough. Laura's Law is helpful for a small group of folks who just don't respond to street engagement.
Yeah, and really, I'm sure that the discussion was lengthy yesterday, but street engagement out here is intense and happening, and we're still having multiple issues. So that's, I think, why the thought of another layer, Laura's Law being that other layer, is coming up, because there are definitely people that one would pay attention if they had to go to court. And I'm wondering, if you go to court enough times, is there, in the end, something mandatory that would happen? I don't know. I would have to research.
Not through Laura's Law. I mean, things, when you're involved in the legal system, at some point you get stuck in the legal system and you can be made to do things. But Laura's Law by itself does not. So I think it's a misnomer to call it involuntary outpatient treatment, which some people call it, because that suggests that you don't have any choice. You have to take your meds. Laura's Law doesn't do that. It puts you in front of a judge who says, take your meds. And that works for some people, but it's not going to solve, it's not for a lot of people.
Yeah. I just wanted to jump in, Kathy, and ask you if you have had response from your fire department and your police department if people are in fact breaking the law. Because I think whether you have a mental health issue or you do not, if you're breaking the law, we already have the existing systems of the police department, or at least the sheriff's department, perhaps in your physical location, and the fire department. Because I think, you know, one of the things I, you know, as a peer on the mental health board, you know, I need to speak up for making sure that we do not criminalize folks with mental health issues. And I think there is a real risk and certainly in other counties where that perception of law is law, you know, whatever it does, criminalizes people with mental health issues. And I know it is only a small fraction. So I guess I'm really asking is, you know, can we leverage the legal avenues that we do already have to address this particular issue of fires? Because we're all terribly afraid. And I was at the board meeting yesterday, and there were many people who were really terrified of, you know, fires in the Guerneville area because it's so wooded. You know, so law is law would be down the pike. Is there something we can do right now to help that situation?
Yes, it is extremely dry, and a small fire that during the winter would, you know, stay small, rapidly could turn into something really big. So that is why people are terrified. And I will put myself in that position. When I saw the hillside across from me going up in flames, I was very worried. I was, you know, very worried. And lots of stuff is going on out here, both legally. I mean, there are people that have broken the law and gone to jail, but people out here tend to be very proactive in trying to prevent. The fire department is, you know, as they're passing out fire extinguishers in homeless camps. I mean, it's not like nobody's doing anything. They're trying to provide, you know, lunches so that people don't have to cook out there. So you know, people are doing things, but I'm just saying that topic has come up. I've seen it come up. So, and I don't know, you know, I haven't gone to the point of really investigating exactly what is in the law, but I'm reflecting that it's come up and it's, you know, worth looking at.
Yeah, because I think two things came up yesterday at the Board of Supervisors was the difference between a person who's an arsonist, who's setting fires on purpose, versus accidental fires from cooking and the issues around homelessness. You know, and the solution to those two things are very different. One is to find that person who's the arsonist, lock them up. If it's an accidental fire because of cooking, certainly handing out the extinguishers or helping people relocate to safe camping areas with places where they can cook, either not using fires or, you know, kitchen facilities or prepared meals. So I think you know, if we go upstream to find out the cause, I think the solutions are different.
Absolutely. And I'm glad it was addressed at the Board of Supervisors meeting.
Yeah.
So I just wanted to bring it up while you were still here, Bill.
Yeah, no, I agree.
Okay. That was, I think, what I had to say while Bill was here. Anybody else have anything before we let him go back to his finance meeting, which is probably over by now? Peterson.
There is a hand up, Debbie.
Yeah, I see Peterson and Bob.
Okay.
Okay.
It seems, Bill, there's challenges in recruitment in some, apart from shortage of providers. Is there anything? Is remuneration part of the challenge for people to come to the county to to work in that area?
So the county hiring process is burdensome, right? So it's not good. It takes too long, and we lose people. We are regularly looking at ways to make it more efficient. There are just limitations in the civil service process that we can't get over. So granted, our recruitment processes are not designed to get people on board quickly, and we lose people during that process. In the past, our pay compensation has not been adequate. That a year and a half, 2 years ago, we renegotiated salaries, and I'm told that our nursing salaries are now in the competitive range.
Okay.
And then after that, you know, we just, it's just hard to get people. I mean, we just went through the recruitment process with somebody, had them all signed up, and they just decided they were going to go take care of a family member instead of come to work, right? So I just look at that as a COVID. It's both a regular nursing shortage and a COVID nursing shortage layered on top.
All right. I was just wondering whether there's anything that could be done to streamline the process, or to or for something compensation wise too, because this is a chronic problem, and I don't know, we can't be in that chronic state all the time. Otherwise, we don't meet, you know, our obligation to our citizens.
Yes.
Are we in a position to do hiring bonuses, sign-on bonuses?
Not for the county. You know, any kind of move like that is a bargaining issue before it even becomes a budget issue. So it's really not been an option.
Bill, when is the PUF scheduled to open?
January.
Does that look like it's on track? Or?
Yeah, it just got through some permitting processes that actually pushed it from December into January. So that was a good news, bad news. They got through a permitting process, but it pushed the start date back a little. But yeah, I hope they're able to recruit new staff, right? They'll start that a couple of months before they open. We'll have to see how they do.
How do they work the issue though with COVID patients, because or vaccination and?
You know, I don't keep track of the details, but there is state guidance for facilities, and they follow the state guidance, and then they add on their own additional requirements. Before vaccinations, they were requiring the people to have a negative test before 3 days before admission, and then they stopped visitors, and then they were testing staff quite a bit. So now that everybody's getting vaccinated, I know some of that's changed, but it's still the same kind of strategies. You know, limit the number of people in and out of the facility, be testing people, and be getting people vaccinated.
And just another unrelated question. With opening the PUF, shouldn't that save you a considerable amount of money rather than paying outside hospitals, or you could build Medi-Cal, or will that create any savings?
So it will result in some savings. So anybody who goes into a non-Medi-Cal hospital who's 21 to 65 can now go to the PUF at less than half the cost. So
Right.
They're a portion, but not a majority of our hospitalizations. However, you know, my experience is whenever you open up a service that's been needed a long time, there's pent-up demand you didn't see coming. So what I'm worried about is somehow the system is going to respond by jumping into that vacuum, and that we're going to not realize a lot of savings. And that's just me being pessimistic. I hope I'm wrong.
Okay.
But that's, in my experience, that's always a potential whenever you open a new program.
Okay.
I have a question, Bill, on that topic. Could you remind me how it was determined the number of rooms or beds that there were going to be in the PUF as opposed to 10 more than was requested or was suggested and so on?
Yeah, so 16 beds is the limit that the
Okay.
federal government allows for freestanding facilities to be a Medi-Cal facility. If you are
Okay.
associated with a general hospital, you can be bigger and still get Medi-Cal. Otherwise, you have to be 16 beds or less, or you become a non-Medi-Cal facility.
Okay. Thanks.
It's called the IMD exclusion. If you,
You've thrown around about 743 acronyms during your report today. I'm researching diligently.
yeah, it's gotten so bad.
I'm always
I'm
lost
not
with those
keeping track of them.
acronyms.
Yeah, usually I take pride in being the acronym king, but I can't even keep up anymore.
Yeah.
I only get 10% of the report because I don't understand the 90% of
should
the
always stop
acronyms.
me. You should always stop me. Make me say what the acronyms. Keep me honest.
Okay, Carol, and then we better let Bill go.
Yeah, I just wanted to kind of link back to the Board of Supervisors meeting yesterday that the funding from transitional housing to help with operating costs would prevent the sale of half the beds as a way to fund the PUF. So I think the discussion was really that it was more important for us to keep the beds and to sacrifice transitional funding for a short period of time. So just to kind of understand the extent of the complexities of moving funds from one place to another. So I certainly was in agreement that we need to keep the PUF beds.
Yeah, I'm glad we didn't go down that route. That would have been bad news.
Bad news, yeah.
Okay, thank you very much, Bill. Sorry
Thank you all.
that took up all that time.
Oh, I enjoyed talking with you. Take care. I'll see you at the board meeting.
Okay, sounds good. Okay, so we are, we've just got half an hour left. We need to talk a little bit more about the application process. And then I've got, I think, 2 more things that are really important, and then we should get it all in. Yes, Bob Cobb.
If we put together something, I think it was suggested in the earlier conversation today, if we would put together some sort of guidance perhaps and distribute it to the Board of Supervisors as to what might be a suggested way to, in the process of their appointing new members, that may have some impact. As we did not too long ago, let them know, and I think Bob Hales was, I might be wrong, I think Bob Hales was involved in this, putting together what the mandated proportions of the board should be as far as consumers, family, and general community members. I don't know that they were aware of that, and so hopefully that would have some future impact. But if we expand that a little bit, letting them know what would be advantageous actually for the applicants to get some exposure to the board before finally considering that they want to be on it, instead of it being a theoretical thing, maybe that would have some impact.
So I would be willing to work on that with you, Bob. I know that I put something out that Bob Cobb sounds like he's referring to, but maybe you did as well.
Well, no, I think I don't know. Possibly you did. Maybe Bob Hales has spoken of it before, but I'm uncertain. Whoever should get the credit, I give it to them.
So if there's somebody else that wants to work with Bob Cobb, I'm fine with that. I can contribute what I put together, and if Bob Hales, if you put something together, we can pass it on to them.
I'd be delighted to work with you. So
Huh?
I'd be delighted to work with you, you and Bob.
Okay.
Carol?
I was just wondering, each of the districts has 3 representatives. And since I've been on the board, we've really never haven't had an opportunity for each region potentially to get together. I'm wondering if there could be an opportunity to do that either on an executive meeting, that there would be 5-10 minutes allocated to, breakout groups for specific districts, or between meetings that we have, maybe not every month, but maybe at least once a quarter, a meeting of, for me, I'm in District 2, so it would be myself and Marianne, and I'm not sure if we still have a third person.
I don't think so.
Not at this point, but just so that, potentially we could negotiate or connect with our Board of Supervisor on a more regular basis. I'm just trying to kind of think of ways that we can connect with our Board of Supervisors so that we kind of keep them in the loop.
I think
If I could just, I'm sorry, if I could just say for Supervisor Rabbit's members or appointees, we used to, and the supervisor was very generous. He would meet us for coffee at one of the local coffee places. And his 3 representatives, we would talk with him about things we felt were urgent. He was always generous with that time and bought us the coffee, which was very sweet. And he seemed to enjoy it a lot. And we haven't done that in a while. And I think a lot of it is just this whole COVID thing has put a huge change in everybody's get along, I guess.
Yeah. So I did yesterday leave a note for him regarding some other issues that I wanted to talk to him about outside of the mental health board. But I'm wondering, since I don't know if you feel comfortable connecting with him, Marianne, is that something that you'd like to do again?
Not in person at this point. It just, we're old. My husband and I are now old, and we are very worried about staying away. We are vaccinated and wear our masks and all of that stuff, but it just seems like this is a very precarious time for any social engagements. Forcing me to learn to use Zoom.
We could do it by Zoom. We could do a small group meeting by Zoom.
Yeah.
I don't know, but anyway, I just
it's a good idea, and I know that Bob Hales and I have met with Linda, and that's something that it's a good idea to meet with your supervisor, and I can send out that reminder that that's something that people should do. I know that Bob Cobb, you've met with Supervisor Gore before, and I know that I think she just disappeared, but oh no, there she is with her hand up. Betsy, I know she's talks with her supervisor. Betsy, what did you have to say?
Yeah, I was actually just going to mention that I meet with Susan Gore and Supervisor Super Gore once a month.
So that's great that you do it once a month. I'd be happy if people did it, once or twice a year. Yes, Peterson.
Okay, I think Susan is pretty open to those discussions, and when I don't meet with her, we communicate via email quite frequently, and she actually invites us to meet. She's one of those who invite us to meet with her. So
that's great.
We shouldn't have a problem meeting with her at all.
Okay, so Bob Cobb, would you like to work with me? We can do it over email or whatever and come up with something to propose to give to the supervisors, especially if they have.
Right. I don't think there's a big deadline, but since there are vacancies, it might be good to get something to them prior to the next round of appointments.
Yes. Okay, so I'll put that on.
And Bob Hales, I guess, volunteered himself, I believe.
Whatever you say, Bob.
Yes. So I would volunteer to connect with David Rabbit if you'd like to meet on Zoom. Marianne, would that work for you?
I can give it a go. I'm still very much in the amateur class getting connected to some of these things, but I can work on that.
Well,
it would be identical. It would be identical to what we're doing today.
But you don't know the background story to me actually getting here today.
Okay, okay.
With no supervision from my resident IT person, my husband.
You've come a long way, Marianne. We realize that.
Hey, thanks a lot.
Or I by telephone then, maybe I can call you by telephone. How about that?
I still use the telephone. Yeah.
Okay, I'll give you a call. I'll give you a call.
Okay, sounds good. I want to kind of, as a preface to Carol talking about the peer certification, I want to do a quick report on the QIC meeting that I attended. And I've got my notes right here. I found them. Got too many papers in front of me. So every year there's a EQRO report, External Quality Review Organization, I think it is, report. And the final report for 2019 is out. I think it's 2019. Anyway, the previous report had 22 recommendations. We weren't doing great. And I'm not going to go into details. It's available online. And Wendy is going to try to put together a one-page summary for us. She's also thinking of putting out or recommending that QIC puts out a one-page summary of the public, things that should be told to everybody, a one-page newsletter. So I'm looking forward to that. On the other hand, Wendy is relieved of her duty as far as COVID. So she's now able to focus on her new position in charge of adult teams. And so she will also not be in charge of QIC. They've hired somebody else to do that. So it's definitely a recommendation, and Erica is co-chair, so hopefully that newsletter will come out. But we've improved significantly, and the latest report only has 6 recommendations instead of 22. One of the big recommendations is that we increase our employment of peers. And so Carol was able to present at one of the QIC meetings, and it matches up directly with what the county has been told, get more peer involvement. And so focus groups have been focus groups are going to be put together at peer centers and with Community Partner Connection. They're going to try to put together a Survey Monkey, and NAMI's going to be holding focus groups. And questions have been formulated to go out to those focus groups. So from the QIC side, that is happening. And that was a big part of the discussion at our last QIC meeting. So Carol, do you want to report on what you have been doing with that?
Well, that is pretty well the update for Sonoma County. I think that the process for implementation at the state level is moving forward. the Cal Mesa was designated, as you know, as the implementation agency. The concern, I think, still from Bill, as he stated this morning, is that even if we move forward with this and we have certified peers, the funding from Medi-Cal is only half of what it's going to cost to employ a new peer. So finding funding streams, and so that's exciting that they have in fact found some funding for a new peer support person at the CSU, and that they would continue to have the second person based on the extra help position that they're hoping to put into a permanent position. So yeah, it's a process unfolding, and I'm really, really excited that the QIC folks are going to help create the conversations. And I guess one of the questions that I did ask at the last board meeting was, you know, could we have a forum physically located inside of our meeting, like we do a special presentation? Would that be something that the mental health board feels would be appropriate use of our time to have a conversation around what peer support specialists, who they are, what their background and training is, and potential places that they may be included into the system of care. Right now we have the peer centers, and we have West County Services are in charge of them, but there are many, many other places like the CSU and, you know, discharge from jail, you know, just to mention two more that may be points that peers could be employed.
So, okay, so that's kind of an ask of us for a future meeting. And that brings me to the two other things I wanted to talk about. Now I've got one in my head and the other one will pop up again. This next meeting, the September meeting, is Melissa Ledrette is doing the MHSA annual review. And so I don't think there's going to be a lot of time to insert other things into that meeting. I'm asking, I guess, is the 2 hours enough? We tried when we had our in-person meeting, we tried to extend the meeting time half an hour, and I talked so fast that we sat for 20 minutes. So I'm thinking that the 2 hours is plenty for Melissa. But I haven't asked her directly. So at this point, I'm kind of assuming that the 2 hours is plenty. If I hear differently, I will certainly let you guys know. But I think that will be enough. That was one of the questions. Do you guys agree with me that the 2 hours is enough?
I feel that 2 hours is, it should be plenty of time, and Melissa has awareness of the normal length of meeting time, and so I would think that she would have brought to our attention that if she had something that needed an expanded
That's what I'm
time span. Yeah,
thinking as well, because she knows how to get hold of me for sure. Okay, so we're just going to leave it at the 2 hours, and I'm, unless something extraordinary comes up, that's the way it is. Which I think she will use the 2 hours though. So, Carol, you now have two things that you would like to bring to us. One was the panel of people that you were talking about from the jails, the ones that were, being released from jail. that and the peer one, and October is focused on South County issues. So we have to decide what, we don't have to decide today, but all three of those issues, Carol, are yours, really. So we're looking at the October meeting. Wendy also said she would be happy to present a brief overview of the EQRO findings, but I think that would be very short. So the next meeting, September, is set with Melissa's Mental Health Services Act annual meeting. We're looking at October.
Well, I think I'm not sure how. I know I can see Mary Frances is in the attendees, and Robert's here as well, Bob. I'm not sure about the jail panel at this point. They've kind of would be ready to step in if we wanted it to. We haven't done any work on it. Maybe it is time for us to get together and find out how the new jail is moving along, because really that was the motivation behind that, was the progression of the new jail. I'm not sure if COVID has impacted that or not, but
we could look at November as well.
I think for me personally, I think the SB 803 implementation or peer certification process feels more urgent and imminent. The jail issue is not going to go away. It has been a problem and, will be a concern moving forward. But I think the SB 803 is a process that's unfolding as we speak. And so it feels like unless we have the conversation now, decisions will be made without community input. It'll just happen. So, if I have to choose priorities, I would definitely choose if it's something that the board feels like you'd like to do, because obviously the QIC is going to have meetings outside of the board, but it does feel like the board would be a good, from my perspective, a good place to have a conversation.
Bob?
Yeah, I agree completely with Carol. The Sheriff's Department, in terms of responding to emails or contact, has been less than desirable. And plus, I think what Carol articulated with 803, I think is much more important. So I agree with her completely.
Excuse me. Okay, so
do you think I should maybe collaborate with Wendy, since she was very gracious to kind of give QIC credence and energy behind the forums, that this could be just included as one of the forums? They're going to do it at the peer centers. NAMI is going to do one, and it sounds like there were several other places. Mental health board could just be included as one of those forums under the QIC.
Okay, I think that the mental health board meeting could be included as a forum, but I would also think that we would invite the peer centers / West County to give their input on what is happening, what they're doing.
Can we also present at those other meetings, for example, the NAMI and the QIC from the board, and have one for ourselves?
I think anybody can go to those, can participate once the forums are set up. I don't know. I don't know about presenting as a board. I'm not sure what you're suggesting.
No, I'm presenting our support for it or support or not supporting it. And it's like when they have the presentation, maybe a board somebody from the board is saying, "Hey, this is our position from supporting it from the mental health board itself," and then having a forum where people will participate that the mental health board will put on, like Carol suggested in our last meeting,
So,
so that our presence is seen not only in one place but showing support for the peer center, which is a very important aspect of delivering services. So the more we show our faces at different forums, the better it will be, like our voices are being heard, at least.
okay.
Yeah, so I guess really the question then is, what would that forum look like? And what I'm hearing you say, Kathy, is it would be good to have representation from as many groups as we can who are involved, either be part of a panel or at least be present in the audience.
Yeah, I think we need to think a little bit more about exactly what it's going to look like. If the questions are there, that I think the questions that are being asked will be asked at all of the forums. The question I have is about audience. Will we have the audience? And how do we get that audience?
Yeah,
so I'm sorry, Carol, if I could just say West County Community Services is sort of the umbrella group leading the peers, as I understand it. I think we need to get them on board, their input, so we don't step on any toes, and they have their own community organizing power to bring to the table as well.
Yeah, so I'm in regular contact with Christy DeVilla and Tim Miller, who I used to be employed as you know, at the Peluma Center. I'm regularly in contact with them through the Sonoma County Peer Council. So Michael Reynolds and certainly the peer liaisons or managers. So Sean Boland, Sean Kelson, potentially Cameron Scuddy and Michael Martin would be the key point people from each of the centers. And they could get the word out to peers themselves who are employed in those locations, because it will impact them directly. But I think it's also important for us to think outside of West County specifically and the peer centers, in that peers can be employed across the system of care. So, CSU, transitional housing, SUD services, and multiple other locations, transitional age youth, voices, say, just to name a few. So I think when they're talking about integration of peers across the system of care, they're talking about more than just having peer centers, as much as that is awesome. And we are really lucky to have that.
So
yeah.
I'm thinking, Carol, of reaching as many people as we can to be involved, because if we have a small audience, I would like to have our audience larger than smaller. I think we would get more input that way. So if you want to reach out to those people that you have talked about and maybe spearhead this presentation, I would also contact Erica and Wendy.
Yeah, certainly both of them from their role in QIC, but also Erica has multiple roles. And one of the biggest, I think, that would help us in this particular case is the community of practice or community partnership meeting that she does on a regular basis. I think there's about 40 different agencies attend that meeting.
Yes, and
So,
Wendy will be in charge of the adult teams for the county, so that she'll have another
yeah.
avenue. And she's the one that is responsible for the QIC report. So she knows what the county has been asked or directed. So
Yeah, so maybe a panel that includes Wendy and the and Erica and a representative from 1 or 2 from West County. Or maybe I can talk to Wendy and Erica and see how they imagine the other forums operating, and we can just do that the same for this one. But to really maybe create a flyer and do a lot of outreach to get as many people at the table as we can.
okay, so the next question, and we've got a minute left. So the next question is, do we want to do that October or November? October being South County issues. I think that's, it's a South County issue as much as everything else. But do we want to have that, the South County, do we want to set aside some time for it, or do we want to actually have this take up the whole meeting and maybe have it November, which makes it late, but.
We could bring it up in October to get people's attention as a heads up, and then have a full meeting in November when it's, I think of it, not the outlying areas, but the central area. Have it in November. Challenging times though with.
It is. And Carol, you would know if there would be a reason for timeliness issues to have it earlier.
Yeah, I think that, sorry.
I was gonna say, it's September. We could actually make the decision later, but I think that it's important to know for your planning, Carol, if you're putting it together, if it's going to be October or November.
Yeah, I think we could do it by October. That's a month away. A month and 2 weeks, or a month away. And the only other issue that I think, I'm sure there are multiple, but one of the things that the board might want to hear about is the SAFE program, or the new Cahoots program in Petaluma. But the hope is that they too, the mobile support teams or the Kahoot model teams out of the 4 different, the mobile support team and the 4 cities, that they would also potentially think about including peers. And may well be willing to kind of think about that in the context of this conversation.
We could also move the South County focus meeting to November if the timeliness issue was there.
Yeah. Unless there's another topic, I would, if we can, if Wendy and Erica are available for October, and West County, are able to make that meeting, I think I'd like to try and make it for October.
Okay, does anybody object to that? And we can decide if there's more pressing need for South County to have more time. We could put them into November if that feels okay.
Okay, and I can work either way. Yeah.
I'd like to make sure that any South County issues that we are not currently discussing, that there is an adequate time so they don't get squeezed out. that's it's only fair. I'm not sure how important it is to maintain the what I guess traditionally has been an October South County type of thing. Every quarter a different quarter of the county. But I don't want to. I don't feel comfortable with trying to do too many things in the singular meeting, especially if I don't know if South County is already the people who may choose to present whatever issues are going on in South County, if they are already gearing up or aware that this has been pre-scheduled. It's probably on the calendar already. So I want to be very careful to honor the time that may have already been allotted to them.
So if usually like Carol or Mary Ann would contact those people and ask them to present. Bob, are you comfortable if they talk to the people that would be presenting and November is acceptable? Would you be comfortable with having that meeting then?
Sure. But I think they certainly need to have some input on that choice. Whoever might be presenting, if they're okay with November, that I have no problem with it. I just don't want them to be squeezed out.
If Carol and Mary Ann talk and decide which meeting is when, is there anybody that objects to letting them make that decision? And let me know fairly quickly and I'll let everybody else know. Okay? That's
Okay.
Mary Ann. Sound okay,
Okay.
Carol?
That sounds fine. Mhm.
Okay. I don't think there's anything else real important. Oh, can you put out the Bob? It's 12:05, but you wanted ideas for places to visit. Can that be done via email or do you want to?
Yes, it can be done by email.
Okay. Okay, so expect an email from Bob asking about places to visit. And I have a question for you anyway, so I'll be emailing you.
Okay,
Okay?
thanks, Kathy.
Good job, Kathy. Thank you.
Thanks,
Okay,
Kathy.
we'll see you later.
Thank you.